Hi everyone! Welcome to our video on how to recognize thrombosis in an AV fistula. An arteriovenous fistula is a crucial access point for patients undergoing hemodialysis. Recognizing the signs of thrombosis early on can make a significant difference in patient outcomes.
When an AV fistula has a clot inside, blocking the flow of blood, this is called thrombosis. And early detection of thrombosis can significantly improve outcomes. Here are the key signs to look out for. When you listen with a stethoscope, a healthy AV fistula should produce a bruit, a whooshing sound. If you don't hear this, it could indicate a blockage. If you are unable to access blood during cannulation, this might be a sign of thrombosis. A healthy vein should compress easily. If it doesn't, this could be due to a clot. White or gray structures inside the vein can be visible signs of a clot when examining the vein. Color Doppler ultrasound should show blood flow. If there's no detectable flow, thrombosis might be the cause.
Recognizing these signs early can help ensure timely intervention and patient care. Thanks for watching and stay tuned for more healthcare insights.